with females, you see at a young age, they're young, beautiful, active. When they get to a certain age, like our grandparents, they'll just like to sit at one place for 24 hours. Yes. And with that spinal deformity, sometimes you hear our grandparents not able to stand up, or maybe even when they want to stand up and they are supporting this, they're not able to perform. So that's where the neurological problem comes in. With the neurological problem, like I said, it plays with the central nerve system, which gives you signals to move, to smell, to breathe, and all that. So imagine that part is being damaged for over years and you haven't attended to it. As time goes on, you'll find it difficult to move. Yeah.
So when it happens like that, can it be fixed, like effectively?
Can it be fixed? It depends, because, for example, assuming I have an obese patient that has the spinal deformity, it's quite going to be difficult. One, the person has to lose weight. Two, the obese patient might have a fear of standing up. Why would they have a fear? Is because they feel that they might fall again. And you having this excessive weight can also lead to this spinal deformity, because sometimes with such patients, you see from the neck going down is like a C, then it goes into a depth, so it looks like the shape of letter S from the side view. So imagine such a situation and I ask you to stand up. He or she will have difficulties, and most of the time you hear them that they'll arch their back this way. Imagine arching your back for hours. You end up having some sort of pain. Yes. And if I ask you to stand upright, it's going to be difficult. So just like the one in the image there, you see the dark, is it dark black or dark blue?
Black.
Yeah, so it says what correction surgery. So the correction, so this is what we have. This is the kyphotic deformity. So you see with the kyphotic deformity, like I said, if you remember our elderlies with the four walker, when they are walking, they can't look up. They're always looking down, so they're always seeing their shoes. Now it says well correction surgery. So this will be the worst case scenario where you have to do a surgery. And when the surgery is done, these are bolts that will be screwed into your disc.
Oh wow.
And you're going to be bedridden for some weeks depending on your age. Whether if you are 60, it's most likely that you'll be bedridden more. If you're a younger person, you'll heal faster. And now it says what lumbar motion is restricted after surgery. Yes, so you will be restricted to do certain things until the spine is healed fully. That's where physiotherapy will come in. That's when we'll have to reteach you how to walk, reteach you how to bend, reteach you how to a whole lot. So it's like a whole baby process. Yes, and you know, patients come in, their trusted doctor or doctor will say, do a surgery. Why I'm saying this is because I get surprised by people, because if I, God forbid, I tell you go and do surgery, most people believe that they'll go do the surgery, their problem is solved. And when you tell them that okay, after the surgery now you have to continue, people are shocked. Which me personally, I don't know, because the spine itself is a very delicate thing. Yes, so if you're telling me from 60 and this patient in such deformity, it will take time. Yes, so if I might say 3 weeks, maybe somebody like in their 60, maybe it will take 5 weeks, 6 weeks for the spine to heal before they're able to do learning how to walk, how to even run, even how to pick up objects from the floor, which certain restrictions will be limited. Yes.
Okay, so how is the examination for spinal deformity conducted?
X-rays. X-rays is the best way to examine, but again, like I said, X-rays, MRI, but the best thing is to do when you have an X-ray. It's also good to do a physical examination, because truth being told is that sometimes X-rays don't capture every detail on. So we have the normal X-ray, then we have the one that is more detailed. So if we are talking about the normal X-ray to just make a huge picture of your spine, but if it is a detail, they have series of each disc, each disc, and it's like to be zoomed in to see how bad the damages are. So, and like I said, when you do an MRI X-ray, it's better to do a physical one too, because at least with the X-ray I can look and then try to compare the physical body, that okay, this and that, because there's situations where X-rays are done, but the patient has more damages than what is shown on the X-ray. So yeah.
Okay, but what exactly are some of the causes of this?
Causes.
Yes.
Causes. Like I said, you can be born with it. Why do I say born with it? There are situations where a lady is giving birth and the formation of the spine, the baby, is not completed, so which can lead to a spinal deformity.
Right.
Another one is that when a lady is giving birth and maybe is delaying, so the baby maybe starts to choke on the liquid form in it, that which can damage the brain. If it damages the brain, it also damages the spine. Yeah, so I don't know if you've seen such situations where there are babies that can't even hold their neck. Yeah, so the weight of it, it's just drooping. Even if you push their head, they can't hold it to just droop down. So these are situations, and it's usually when a woman is giving birth and she's delayed, or there's a complications, that's where spinal deformity can happen. Jobs we do, the improper way of lifting, the improper way of lifting, the way we sit. If you know you have a history of osteoarthritis, which is fragile bones, that can also lead to a spinal deformity. It can be inherited. So these are all causes. Yes. So like I said, if you know you have a poor posture and you feel that, okay, yes, when you're young you won't feel it, but when you get to a certain age,
you feel it.
Yes, and then sometimes it happens also with ladies when after birth, after giving birth to a baby, because they're arching their back so much and all. Sometimes you hear a lot of ladies complaining that after giving birth they've had a lot of pain. They are not able to sit for long. They have to sit in a certain position to be comfortable. When it comes to men, it can be due to the jobs that we do. So if you know your job involves in heavy lifting, it's most likely that when you get to a certain age, you will find it difficulties. For example, like a mason. When they are young, you see them developing their backs very nice. But if you've noticed a mason, when they get to a certain age, you hear them, they are having a lot of problems, especially with their lower waist. And when it affects the lower waist, it's a big red flag, because it's totally half of your body that is not properly functioning. And as time goes on, if it's not approached, you lose the ability to walk. That's where the central nerve system comes in.
Okay, and talking about children, since you mentioned that earlier, what are some of the types of spinal deformity when it comes to children?
Well, I wouldn't specify children by it to everyone, but like I said, a child can have scoliosis, kyphosis, lumbar lordosis, cervical lordosis. Like, it keeps going on and on. Yeah, so.
Okay, okay, but this big words that you're
I
saying,
know.
how are we supposed to even understand what you're saying?
That's why I said there are so many. So let me just explain two.
Yeah, the basic ones.
So the
or
basic
the common
one.
ones.
So like the one that was displayed, I think I
Right.
saw kyphotic and scoliosis.
Okay. I'm sure they will show it.
Yeah. So, okay. So with scoliosis, very simple. Scoliosis, if you hear scoliosis or you are diagnosed with scoliosis, just put in your mind that it is your spine is shaped like the letter S, and kyphotic spine basically is the half of from your neck to your waist. You're probably shaped like the letter C. So why I say letter C is because you end up slouching, just like how it says kyphotic deformity.
Right.
Because you are bending down, you're not able to look upwards. You're not able to look upwards. But with scoliosis, you're shaped like the spine is shaped like the letter S. So which means that one shoulder will be down, one will be up. Your hip, one will be hinged, one will be down, one will be hinged up, one will be down. So most likely when you're even walking, your shoes, the heel of your shoe here will rub off faster than the other. You will not be able to stand, you wouldn't be able to stand for long. So you see, so something like this. So it says kyphosis, scoliosis, and lordosis. So you see, with what it says abnormal sideway curvature, that would be the scoliosis. The one that says abnormal pronounced, yes, that would be the kyphosis. And then the lordosis is talking about the lower part where it's hinged outwards.
Right.
So that's called hyperlordosis. So basically your hip protrudes backwards more. Yeah.
Right. Okay, now let's talk about spine disorders. What are some of the kinds of spine disorders? Or let's just look at 3 of them.
Yeah, a lot.
There are a lot. So let's look at 3.
When we talk about spinal disorder, okay, one would be the neurological problem. Another one would be a breathing problem and mobility. So if we talk about like the definition I said, spinal deformity.
Right.
Spinal deformity is basically, it could be a sideway curvature, but it doesn't help the spine to do its job. So it reduces the mobility. So for example, since Valentine's is approaching, I'll use that as an example. Yeah, so imagine you have such a thing. You have to go and meet your girlfriend or your boyfriend. You are not able to do, yes, you will be able to do it.
Right.
Don't get me wrong. You'll be able to do it, but the pain you are going to experience is going to be a lot. Because at a young age, fine, you will be able to endure it. But when you get to your 60s, or let me just say from your 50s, going downwards, you are going to be experiencing a lot of pain. So I have one colleague, he has unfortunately scoliosis. He started early, started early to have a family. But every time he tells me that after doing it with his wife, he has pain onto the side that the muscle starts to squeeze him like this, like somebody is holding him like this. Yes, and maybe when he has to even try to chest out is a problem. Or his back, if you look at his back, you see one side is the muscle development is very abnormal, and then you see one shoulder protruding outwards, and then other one is normal. So when you look at the whole back of him, you can see even the spine, the spike, right? It gets to a certain so when you get to the lower side, you can see the spike of the spine. So imagine you're doing such an activity, fine, you've performed, but it gets to a point that it really affects your sexual organs, because you're not able to stand for long. Why? Because of the pressure you have. So imagine I'm like this all the time. Now I have to act in such a way with my wife or girlfriend. Yes, you'll be able to do it, but you find it very difficult. There are situations where females or males will say that when they're about to release, they have so much pain as if a knife is cutting them. Why? Because of the constant pressure they have onto their body. So the spine plays a very big role. So imagine someone in such situations. And the most scary part is when they get older. My question is, what are you doing now? Because you might be 30, 40, 20, whatever. You endure the pain. But my question always to them is, what are you going to do? Because as you get older, your healing mechanism drops down. Your everything drops down. So is it that people are ready to be bedridden? That's something I ask myself all the time, because I feel like I say people wait to the worst case scenario, and when they wait to the worst case scenario, it makes my job a bit difficult, because whoever is taking care of them is hoping for them to be back to the way it was, but sometimes it's too late. Yes.
But which of the spine causes paralysis?
Which spine?
Yes, which of the spine? Is it the whole?
Yes. I mean, even if somebody should hit you with a stick and with a nail, and they hit you on your lower waist, your mid spine, you can get paralysis anywhere.
Really?
Yes, you can. Paralysis is something that once it destroys, in between the spine there's a little hole, so which is something called the 12 cranial nerves. Your function to move, to smell, to see, and then all that. So imagine you are even without the nail, forget about the nail. Imagine you got hit by a stick very hard. The inflammation you're going to get, we don't know how bad the damages is. You hear on TV how maybe a car knocked out somebody and hit and run. It has caused the paralysis because of the impact of the hit. That is why, and if it's not approached early, that's also, yes, because there are situations where patients come in, you hear that they got hit, they haven't approached it early, maybe due to some financial issues, and sometimes you see the legs being shrinked because lack of mobility. So assuming this was approached early, we could avoided certain things. So, and when the lower limb or any limb shrinks, their muscle shrinks, is a big red flag, because that means, one, blood circulation is not moving around, no mobility. Most likely is that it gets stiff and it gets stuck. So imagine I have to be stretching that specific limb. It's going to be painful, because what I might take your leg, you won't feel any pain, because everything like there's constant blood circulation. Now imagine somebody who got hit, now there's a blockage, no circulation is coming to a specific limb, and I now have to stretch. It's going to be a very crucial pain for that person.
Okay, and I also want us to look at some of the diseases that actually targets the spine.
Diseases that targets the spine. Okay. I'm listening.
No, I'm asking you, what are some of the diseases?
But you did your homework.
I did my homework.
Yeah.
Oh yes, but you are here to actually educate
so
myself and my viewers. Is that not the case? That is actually the case.
Okay, so
educate us.
So what did you find out?
I didn't find out because I know you'll be here to tell me. So educate us.
So spinal what? Diseases.
Diseases, yes.
So okay, the spinal disease. What else? Spinal disease. There's something called spinal stenosis. So that's also another big major thing.
Right.
So the spinal stenosis we are looking at a very specific area, which is the nerve. Well, it plays more of the nerve issue. So if I should define the nervous system, is basically we have something called the central nerve system. For example, when there's a newborn baby, we have a test. I don't want to mention any big names. We have a test we call it Babinski test. So the Babinski test, yes. So we call it Babinski test. The whole point of this test is that we take the foot, and you know the pen cover, we just write the letter B on it. Now when we write the letter B, it's supposed to be ticklish, right? So when we write the letter B, if the fingers are going like this, that means there's a problem with the spine or the central nerve system. But if it is pushing away, that means everything is okay. Right. So the whole point is to see the baby's reaction, or even not even just a baby, but even sometimes you have to do it on adults to see the reaction, because sometimes when you write the B. Because it's ticklish, so you want to push away, but here are cases that it brings it, the fingers will come forward like this, then you do it again, then it comes forward. So this is not a new, but a way of just to identify if there's a problem with the central nerve system. Yes.
Okay, but are there also any known cure for spinal diseases?
So when we talk about spinal disease, it also depends on
the kind of.
Yes, and the condition itself. Because like I said, the whole point is, when is this approached? Because if it is approached late, it's quite difficult to deal with. But if it is early, we can avoid certain things. Problems. Yes. So can it be solved? There are situations where it can be solved. There are situations where it can't be solved because age is a factor. The day and time that the injury was, because you mostly hear people talk about, they didn't have enough funds to do this. When they get the funds, maybe it's too late. So like I say, it all depends on the situation. But can it be solved? Some can be solved.
Some can be solved. Yes. But what are some of the worst case scenarios, like per your experience?
Worst case
scenario.
Okay. The worst case scenario. I had one big bodybuilder.
Right.
He came, he said he lifted something beyond his weight, and he had a pop in his spine. The following day, he said he couldn't lift up his leg.
His leg?
Like he can't move.
Wow.
Like he said he lifted
an object,
but he could like literally there's no function to his legs. So that was the worst case scenario. But again, yes, to reteach him how to walk, and he was quite heavy too, so you can imagine to reteach him how to walk, to do certain things, and it's a long process. It's just like teaching a baby how to walk. So if you're not being continuous, then it's gonna be a huge problem. So there are people that will come for the treatment. That's the thing. People come for the treatment, feel a little bit better, stop. Then when they stop, and something happens beyond, and they rush.
Rush back.
And then because when you rush back, now is double whatever the damage. So now I have to do more work on it to get back to where we stopped.
You stopped.
Exactly.
So it means you literally have to start all over again.
Yeah, sometimes you have to start from square one.
Then it makes the job difficult.
Yes, the job. Yes, it's very difficult. Like people. Yes, sometimes I get really tired sometimes because you sit down, explain nicely, calmly that if you want better results, this has to be a continuous thing. If it's not going to be continuous and you stop and you come back when you feel that the pain has increased, then I have to start from square one to get a better result. So, but like I said, most of the time people feel like I'm Jesus.
I know, right? Once they are not feeling well, they just need a quick, cure and all of that. I've been there before. Not in terms of spinal stuff, but I mean, nobody wants to fall ill.
Nobody wants to fall ill because even if I tell you the truth, that okay, hey, sometimes it's very difficult to answer questions like how long will this treatment take. The reason being that I don't know how long it will take. Is because everybody is different. Right. I might say, God forbid, your own is 1 month. What if that 1 month comes
and it's not cured?
We have to do. There are situations where I might estimate that okay, it might take 4 months, but by the time the 4 month comes, some have healed within 2 months. So it all depends on the person. And again, if you are serious and you say, okay, I want to get better, like I said, you feel better, you stop. Then when the pain increases, which I have to start from square one. So, and the cycle, you going and coming becomes very stressful because I want to finish with you and you can be free.
Right.
Just so that I know that okay, you've been solved. My heart is
All right. Talking about treatment, what are some of the treatment approaches? Does it only have to do with the touches, trying to straighten things, or it has to do with medications? Like people take drugs and all of that.
Yeah, people do take drugs
for the pain or other stuff.
Yeah, for other stuff. Like I say, it all depends because one, the neurological problems. If it is after, for example, if someone should come after a spinal surgery, that means we have to wait for the healing process to be done. Secondly, is that imagine you are bedridden for 6 weeks, 4 weeks, and now you feel hopeless that somebody has to be doing this. And imagine a person that is very independent, all of a sudden you're like a baby, people are taking care of you, so that destroys the confidence and everything. So once the spine or the surgery is being healed fully, that's where the whole process so we call it rehabilitation exercises, the teaching of walking, something with the spine. Now with the clicks and cracks, when it comes to the spinal surgery, I can't do that. Why? It's because of the surgery that has been done. I can only do it on specific areas. So if it is down on the lower side, the lumbar, maybe there's a surgery down there, I can't do certain things there. So just like this kyphotic deformity, where the metal plate is, that means that I'm not able to. So I'm very limited to certain places to readjust. Yes.
This is actually a lot. But so it looks like from all what you're saying, this is not something that you can just sit home and say that I can solve on my own.
Nope.
You definitely need assistance.
Exactly.
So there are no like basic management, methods or something.
No, this one is this. If you have a spinal deformity and you are saying I can solve it myself, good luck, because you definitely need assistance. Like I said, if you say today I want to, should I say, invest and correct my spine or whatever, yes, it's gonna be money. It's gonna be a long process, because if you say I want fast, okay, yeah, fine. The fastest so far was being 1 year.
1 year. That's interesting.
And again, so I'm just putting like maybe a younger person. Yeah, it might take a couple of months. Imagine an obese patient comes. That's a spinal surgery. That might take more months or years. It all depends how bad it is. When you see, the problem we have here is that we wait till the worst case scenario. When is the worst case scenario? It makes things very difficult. You see, ladies are more like when there's a little problem. Ladies are not scared to go to the hospital, right? But when it comes to men have a big fear of coming to the hospital until it is such a big, worse, very bad scenario that they would come.
Right.
So that's the difference.
Okay. But now that you've also mentioned, weight, obesity, and all of those things, what role does weight also play in spinal deformity?
So what role? So when we talk about weight, the weight you have, so the more weight you have, the more pressure to your heart. And the more pressure to your heart, the more the heart has to work to pump in blood, which...
Now you are scaring my viewers.
Which can lead to a heart attack. And if it leads to a heart attack, now imagine the whole weight you have, and you are constantly complaining of a lower back pain. The more weight you gain, the more the pain that will increase. It's just like me trying to use a pencil for the cap to balance on that single pencil. It's going to be a lot of pressure. Eventually that cap will fall down. So imagine an obese lady. On top of that too, she's pregnant. Double the weight. Now she has to feed herself plus the baby. That's triple the weight. Now imagine she's going to go to birth. Now she has to push that baby out. After pushing that baby out, we don't know the damages she's gonna have. Most likely that maybe she'll have a muscle, some part of the muscle will be torn. Definitely going to have lower back pain. There's going to be all kinds of problems. So how does it play a big role? Yes, it plays a big role. Weight plays a big role, because if you've seen obese patients, to even walk from point A to point B becomes a huge problem. If there's a huge disc compression, when I say disc compression, as in disc to disc sitting on each other, then it's going to be very difficult for a person to move. Yes.
You realized earlier I mentioned that you're scaring my viewers, because right now I'm sitting here and I'm like, so does that mean that if I should gain weight, I'm going to put more pressure on my heart and I'm going to have a heart attack? Please, that particular part you really need to explain so that people don't get scared watching. Because you know that we are in, like, how do I even put this? We are in a year that people are actually trying to lose weight and all of that as a result of so many things. A lot of things are actually putting pressure on young women and even men to lose weight. And now that you're saying that,
it's true, because just look, the more weight you have, that means the more pressure to your heart. When we say pressure to your heart has to work double time to pump in blood, to circulate a whole. It's just like, sorry to say, it's just like a saloon car. Imagine a saloon car, and then I open the boot and I put a lot of cement bags. Obviously the car will sink, and I put more, and I expect the car to perform as well as when the cement is not. So this is what I'm talking. That's the pressure I am talking about. Yes. You might be young, maybe you have excessive look. There are people that have weight. There's a difference. There are people that have weight and their weight is firm. So there, if you've noticed, there are people that are should I say chubby, but if I ask you and another girl to run, it's most likely that she has trained herself. When I say train herself to run, so that means she can move her heavy body properly. But imagine somebody who is just having weight, doing nothing. All she does is eat and sleep. And right now you might not experience it, but when you get to a certain age, you will. Yes. Why do we get heart attack? Because of the pressure we have. Right. The pressure we have onto our heart. Right. Okay. Because when you get a pressure to your heart, the heart has to work 3 times, 4 times, just to improve blood circulation. And when the heart gets tired, that's where you get a heart attack, and that's where we have to start reviving you, just to pump in, just for the heart to beat. Right. So it's I'm not trying to scare the viewers, but
just stating facts, right?
Yes, yes.
Okay, what would be your final words for us today?
Well, my final words: if you do have any problem, it doesn't have to be spinal, but if you do have any problem, please don't hesitate. It's better to solve the issue now and earlier than later. Yeah.
Okay. So, yes. Your socials and how we can reach you if we need any
yes. My booking number is 020-584-1318. 020-584-1318, and social handles are physio and CrossFit. Yes.
All right. Thank you so much for joining us, Elvis. And thank you. We've been educated enough about the spinal deformity, and I hope that you didn't scare us enough. So please, if you are watching and then you are obese or something, please don't be scared, okay? Don't allow Elvis to scare you. I'm here to console you or calm you down. Just make sure you are having enough exercise. Don't just eat and sleep just like he stated. Make sure you are exercising. This year we said we are doing a lot of exercise. We are doing a lot of fruits and vegetables. So make sure that you're taking good care of yourselves. I always say it, healthcare is necessary. It's necessary. That job that you love so much, if you don't have a good health condition, you will never be able to walk from your house to even pick a car to your office. So please take good care of yourself, and that will be all for our well-being segment. I still have more for you here on Sign Up on Showbiz TV. Stay with me. I will be right back.